Good evening, good afternoon, and good morning. This is the 1831st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Dr. RASHMI SHUKLA. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. And I'm very happy to invite all of you to join the 5th anniversary celebration of IFPH on September 28th at Taj Vivenda, Cochin. And there are a lot of interactive sessions, and there will be discussions. There will be some important purpose presentation on agro-homeopathy, veterinary homeopathy, dental homeopathy, and there will be a session for students to interact with the senior and international personalities from homeopathic field. Hope all of you will register. It is rupees 3,000 per person, and those who are unable to come over there can give a contribution for the success of the same. Hope all of you will join us on the session. And let me come to today's session. And today our guest is Professor RASHMI SHUKLA, and Dr. RASHMI SHUKLA has completed MD in homeopathy and is the founder CEO of HomeAid, and she has more than 16 years of clinical experience and more than 13 years of teaching experience, and published many research papers related to homeopathy, winner of many awards, winner of Pride of Homeopathy at World Health Summit in JW Marriott, Dubai in 2022. She has presented different subjects and different topic in this forum, and all the presentations were exemplary brilliant. And today, Doctor will be talking about challenges faced by homeopaths. As we all know that there are so many problems faced by homeopathic students and the junior doctors and even senior doctors. There are laws forbidding homeopathy doctors from practicing so in certain diseases, and they are being produced from the World Health Organization. So we need, it's not only in India, but we need presentations and practice of homeopathy everywhere in the world. As you all know, that homeopathy is a scientific system which which is the second largest system practicing all over the world. But still, we have a lot of problems. As you know, as we grow up, there will be a person who are affected by the propagation of homeopathy. So that may be the reason why these problems arise. So let us see what Professor Dr. RASHMI SHUKLA has to say about all these things. We proudly welcome Professor RASHMI SHUKLA to this session. Welcome.
Thank you so much, sir.
Okay, thank you.
First of all, I would apologize today that somehow my presentation got corrupt, so I'm not on a presentation right now. But definitely, I'll try to give all my points in best possible ways. When my name was already nominated for a topic on so and so date, and frankly speaking, I was not very prepared for some topic or the other, but definitely there was an unfulfilled points or options that I really wanted to cover up, and hopefully I would do it solution centric. If all of you have attended our last session of where we had that brainstorming, that what challenges the patient, the doctors, private practitioners of homeopathy are facing, We had Shaji Kuriyat sir, we had Rao sir to give a right kind of responsibility distribution that were posted or put up upon. But here I would give the mix of both. First of all, you all, those who have started practicing long back and those who are watching who are just about to start or just started, the first thing that comes up is the branding of homeopath. Being a homeopath itself is not strengthening and empowering nowadays. Even at our days, it was not that strengthening. We most of the time, although I was like, my father was also homeopath, so I was very sure that I have to become homeopath and I have to do certain things, and I knew why I am becoming homeopath. By and large, students comes to homeopathy as a last resort कि बीएससी से तो अच्छा है कि बीएचएमएस कर लो, कम से कम डॉक्टर लग जाएगा नाम के आगे, डॉक्टर लग जाएगा तो कम से कम डॉक्टर लड़का लड़की से मेरी शादी हो जाएगी. एंड द सेकंड थिंग दैट कम्स अप इज कि एटलीस्ट देयर वुड बी possibility that I might do some kind of clinical practice. Probably mostly allopathic शायद मैं अच्छे से कर लूं. More or less the basic motivator or the brand image of the homeopathy or becoming homeopath itself is very fragile. The students are coming as a last resort, यानी मजबूरी का नाम महात्मा गांधी टाइप्स लोग मजबूरी का नाम होम्योपैथी के टाइप नाम से आ रहे हैं, और जो एक माइंडसेट जो स्टार्ट हो रहा है वही गलत है. सो the thing is that the first thing that we have to keep on doing, now also I keep on doing, I am some or the other way connected to academics. Every time I am being there in any academic institution, in any role, post, position or responsibility, I always intend, because on the one hand, if it is money, I'm already earning from my clinic, but there is a purpose. So not for paisa but for purpose, I always keep myself associated with the academic institution in view that somewhere these students find right references point to be a homeopath. Now you see the generation that the mixed generation right now here, and I don't see much of the younger generation over here. Most of the generation that is there are already done and dusted with the profession accomplishments. But what all we can do right now, the people are there in the room, that they can do right now is becoming a right reference point. They are successful, but to what extent they are able to percolate that radiance of success or the confidence of success to their next coming generation. So here I would talk both the problem, the challenges, and at the same time the solution. The first thing that we being a homeopath and accomplished professionals, it is now our responsibility to give back to the profession. And what we can give back is leaving back a legacy. When we share a cured case, when we share a accomplished case, it's not always about marketing. It's about creating that confidence, either in public at large, either in the mind of policymakers, but also the junior people or the junior student that are coming out of the educational institution. So for us, it is our responsibility to become responsible and percolate that this is the success and this is the legacy and this is the responsibility that we are leaving for you guys. So the first thing that I want all of us to pledge with is that we will not only record our success cases, but we also promote it to our juniors and students. So wherever you guys are going, whenever you're going nearby to any homeopathic institution, please visit that institution, have an opportunity to interact with interns, tell them what is going through in their lives. See, we sitting in a room where we all of us are practitioners. We are trying to solve the challenges faced by the practitioners, but I think almost all of us have already risen above the challenge level, but because we have learned how to overcome. But why our forthcoming generation needs to go through all of that we have already gone? Why they have to fought for the same thing that we have already fought for? So we have fought for the attention of policymakers, we have fought for the attention of public, we have fought for that rights and the brand endorsements. Now our juniors must cherish and relish that. So we have to make sure that whatever legacy, see, now all of us have probably, means, to be very honest, all of us have some or the other ways created some assets that our children will enjoy. So we have to, the way we are ensuring that our next generation or our familial next generation should enjoy the legacy or the earnings that we have earned. Now it's time that we have to make sure that the professional legacy, the professional inheritance to be handed over to the forthcoming generation over a note that we have fought through this, we have struggled through this, you don't have to struggle through this, now you have to grow up like this. For that accomplishment, the very important thing that is with us is becoming a right reference point, a right role model of the people. So now, you see, if someone is earning probably 10,000 a day or 50,000 a day, and how they are earning, how they are handling cases, what is their clinical management systems, this is something that has to be shared with the students essentially, because they know nothing. I had my reference point as my father, who was a practitioner, and I knew that how, because from second or third year, whenever I used to go to home in holidays, I used to take care of all that compounding. I used to take care of all that medicinal stock. I used to take care of how that is arranged. I used to take care of how finances are being arranged or maintained. I used to take care of ki kaise karna hai. Of course, that time, we being a doctor, we don't take our profession as business, but ultimately we have to agree that it's a business. We are there to have certain ways of establishing ourselves, branding ourselves, and let us not be ashamed of it, because ultimately you have become homeopath. There are many doctors who have opted to do it for social cause, that's okay, but not everyone coming in the profession can afford it that way. So definitely they are there as a professionals, and they look forward to make money and earn out of it. And I think somewhere medical as a profession, doctor को भगवान बना दिया, और भगवान जब बना दिया तो ये भी आपको समझना चाहिए कि भगवान भी फ्री में आशीर्वाद नहीं देता है, आपको भी कुछ ना कुछ कर्म का इन्वेस्टमेंट करना पड़ता है। भगवान फ्री में आपको कुछ भी देता नहीं है। Let us not get into कि whether God gives us or not, but ultimately if we are compared with the God, please understand that even God doesn't work without any investment for free. That's a very candid opinion of mine. So let us not first of all being ashamed that we are or we want to or we should be earning out of cleaning. Of course, I am against all unethical ways of earning, but definitely you deserve a kind of, because whenever I handled many critical cases, I many a times, you see, homeopath has got such a power that they can make surgeries unnecessary. I've got recent 2 cases. When Naresh sir was telling that, I should share some clinical experiences, I will tell you one patient who fell from probably 9 or 10 feet of height directly on his head, broken his neck bones, had his subluxation of all his spinal cord. He had got several fractures in his spine. He went to hospital. He had fully claimed suggestion that he should require a surgery and he should get it operated. And now after that operation, there would be possibility that 6 months he won't be able to move. After that, he would be able to move just, flexion and extension of his neck, cervical spine, and he can't rotate his spine like this. So this was something that was told out of fear. Because he was my old patient, but he never dreamed that, he should, in this traumatic condition, he should come and consult to a homeopath. He was into absolute immobilization. He called me up कि मैडम ऐसा ऐसा हो गया है, मुझे ऑपरेशन बोला गया है, मैं डर रहा हूँ. मैंने कहा सर आप एक बार दिखाइए, लेट मी चेक विथ व्हाट कैन आई डू फॉर इट. इवन आई नेवर न्यू दैट because that kind of severe trauma, because I had received all his MRI, so even I was not so sure, but I always know that something can be done. Not everything probably, but something always we have a scope of. I never knew what scope that does exist with me, but I called him up, I checked him, I talked to him, I understood the severity of symptom, and I somehow with my associate physiotherapist, we took the challenge. We said, okay, we will be curing you. See, we conveniently the cure word has been deleted from WHO and the otherwise dictionary, that complete restoration of health or the existing functions. You see, there is no Google definition of cure is found. I have mentioned it last time also. But we took a challenge that we will cure you. And that same happened. The person continuously consulted us for 6 weeks, means 2 months, and now it's like third or fourth month, he is normal, he is moving around, he is doing everything. So then he started referring the other spinal injury patient, and those who were told tell कि अभी 2.5 लाख की सर्जरी लगेगी, ये होगा वो होगा, and within 2 weeks or 3 weeks there are minor cases that got cured. I'm saying, and I'll proudly say that I have cured. If any legal things are coming up, let us face together, but I have cured. So this is the advocacy that the students are looking for, कि भाई एक स्पाइनल सर्जन से ज्यादा अच्छा या ऑलमोस्ट इक्विवेलेंट, उससे कम टाइम में, उससे कम कॉस्ट में और उससे ज्यादा एफिशिएंटली होम्योपैथी ठीक कर सकती है. सो दिस इज समथिंग we want to be percolated in our forthcoming generation, and that's why I would appeal all of us, those who are there in the room, that keep the record, keep the video audio, take the testimony on the video, क्योंकि फर्जीगिरी सब जगह पे चल रही है. हमें ऑथेंटिक रहना है, हमारे पास रियल पेशेंट होना चाहिए, हमारे पास उसका रियल वीडियो होना चाहिए जो टेस्टिमोनी दे कि मैं यहाँ आया था और ऐसा ऐसा हुआ. और मैं तो कई बार चीजों को ऑथेंटिकेट रखने के लिए लाइव केस शेयर करती हूँ. लाइव केस यानी ऑफ कोर्स विद द पेशेंट्स काइंड परमिशन, because they have obliged now, they have become advocate, but now I want them to become a public advocate, where on media or social media they are coming up and telling ki this is what happened to me. So we have started recording and picturizing the case right from the start, that this is first visit, this is second visit, this is third visit. Now the students are, although the medicines are not shared because patients are over smart, so I don't want them to get into self medication, but the way we handle or manage cases has to be in a way shared with our junior students, so that they get the confidence that how well we are able to handle. The point of confidence, Shaji sir last time when he started up with only that point, that is confidence. So confidence will come from our reference point, our testimony, our cured or treated patients. So this is where we have to start with, taking up the responsibility of documenting all the cases on video, and if possible live, if possible regular updates on your cases, so that students keep on learning what you are doing, and there is a testimony that would exist in due period of time कि ये आज का इसका रिपोर्ट है, ये पेशेंट आया है, ये इसका रिस्पॉन्स है, और ये पेशेंट शेयर कर रहा है कि ऐसे ये इम्प्रूव हुआ है. और ये हर अक्यूट छोटा आपने यूटीआई ठीक किया तो भी चलेगा, आपने बड़ा सा बड़ा ARF CRF किया तो भी चलेगा, but please start documenting on video, try to make it live, so that of course with patients permission, so that students learn. Because sometimes you know होम्योपैथी में हमेशा ना लास्ट रिसोर्ट की तरह हारे हुए लोग आते हैं कि अब तो कुछ बचा नहीं है, ये भी होता है. लेकिन जो स्टूडेंट्स और जो पेरेंट्स और जो पेशेंट एक्सपीरियंस कर लेता है, एक्सक्यूज मी, कि भाई सर्दी हो जाएगी, आप अपने छोटे छोटे, जो मेरे पास अभी कुछ बच्चे आते हैं, एक बहन जो one girl who came to me when she was 2.5 years old, she was a case of ASD and PDA. congenital heart disease. Because of that, she used to get recurrent upper respiratory tract infection, and every infection, usually every 1 से 1.5 महीना 2 महीना, she used to get pneumonia, and she was always sick. She was not thriving, and because of her cardiac condition, although that was like after 5 or 6 years was to be operated, so she was very fragile child, and because of these kind of recurrent infections, she was not thriving well. When she came to me, I took her case. Lycopodium was her constitution. I gave it. I mean, that patient hardly comes again because she is all right. She got operated. Now she's 13-14 years old. अब उसका छोटा भाई, अब उसकी मदर कभी पीडियाट्रिक्स के पास नहीं जाती. उसका छोटा भाई बोलती मैडम ठीक ही है, ये 1 साल से ही ठीक है, अभी 2-2 साल बाद आता है, कभी कभार आता है. सो कभी कभार 1-2 साल में उनको सर्दी खांसी जैसा बहुत ही बेसिक इन्फेक्शन होता है, उसके लिए भी वो हमारे पास आते हैं, 24 घंटे में ठीक हो जाते हैं. नाउ व्हाट डू यू वांट? यू द पेशेंट इज एडवोकेट. शी टेल्स एवरीवन कि सी दिस इज हैपनिंग, और ये हमें उन्हें प्रमोट करना चाहिए एडवोकेसी करने के लिए. नॉट ओनली उनको बोलो चलो आप मेरा पर्सनल ब्रांडिंग मत करो, एटलीस्ट आप होम्योपैथी को प्रमोट करो कि देखो मैंने होम्योपैथी कराई और ये हुआ. अब क्या होता है कि फैक्ट ये है कि हम अमेजोन से और फ्लिपकार्ट से कुछ भी मंगाते हैं, अच्छी चीज निकलती है, जाके हम रिव्यू नहीं देते, लेकिन कुछ प्रॉब्लम होती है हम जरूर जाके रिव्यू देते हैं. ये ह्यूमन टेंडेंसी है. सो नेचुरली गुड को थैंक यू बोलने के लिए हार्डली कोई आता है. जब दोबारा पेशेंट को ट्रबल होता है तभी वो आता है. सो मेक श्योर कि आप हर पेशेंट का टेस्टिमोनी रिकॉर्ड करें, उससे रिव्यूज लें कि आपको कैसा लग रहा है, आप उसका वीडियो टेस्टिमोनी लें, ऑफ कोर्स विथ हिज परमिशन, हैव दैट नेसेसरी डॉक्यूमेंटेशन डन, so that your brand advocacy, your patients are your advocates, they are your living proof that not only you how you are practicing, but it is also that how homeopathy is working. So all juniors, whole world, all common janta and policy makers are looking at it. So हम फिर एक दिन अचानक से खड़े हो जाएंगे कि हमने 2000 केसेस ठीक कर दी. सो आपको आपका रिकॉर्ड बनाना है, एंड ये आजकल डिजिटलाइजेशन का जमाना है. सो यू हैव टू हैव योर कंसिस्टेंट डिजिटल फुटप्रिंट, जिसको अभी आजकल बोला जाता है डिजिटल फुटप्रिंट, आपके वैसे होने चाहिए कि व्हाट यू आर इनटू एंड हाउ एंड व्हाट काइंड ऑफ डिफरेंस और कंट्रीब्यूशन यू आर गिविंग टू योर पेशेंट और द सोसाइटी एट लार्ज. So this is something somewhere I want, because somewhere homeopaths are found to be, overall medicos are found to be weaker in marketing and putting up the things in a way so that trust is created. देखो अभी आप you see there is a small medicine comes up and the huge paper news comes up कि such and such thing is found to be effective on this condition, and some I don't know what kind of underground study has established that this medicine or this new drug or this new composition might improve this and found to be responsible this, and now studies are underway. Even underway studies they are publicizing. You know whom I am talking about. Then why can't we have that collective? ठीक है, अभी I have got a couple of spinal injury cases because I never thought and even patient never thought. But if I have 2 cases, for example, and suppose Dr. Dhanesh sir have 15 cases, suppose Dr. I think Basant sir has probably 20 cases. Suppose Sahani sir has 15 cases. So what we can do is we can gather and collect probably 200-300 cases. Then we can have certain paper, because what I have said is, why I'm saying is this will achieve 2 things. One is not only the documentation and the brand trust is built, homeopathy brand का trust build होगा कि now this is the result that has been created. Secondly, this would be a perfect documentation for research submission. रिसर्च बोले तो ऐसा कोई बहुत बड़ा लैब कोट पहन के बहुत ऐसा ग्लासेस लगाकर कुछ बहुत ऐसे ऐसा कुछ नहीं है. इट डजंट नीड दैट. all you need is papers and the documentation. So this is something that I'm trying asking everyone to create, and once that is created, then we can have a ready material to convert that into a very authentic kind of research paper. Now the second point, the first is confidence that is built up now because we have promoted the result. Now second is with that documentation, we can assemble those documents with all like-minded people because we are in a community, so that community would join their experiences also. Now suppose I have got 50 cases of pneumonia, probably Dr. Manoj has 100 cases of pneumonia, Dr. Sani sir or Dr. Mohan has got 200 cases of pneumonia. Now we have 500 to 1000 cases where we can have that documentation done, and now we can put up, even with that also we can put that up into CCRH as a community body. So, and not only this we have to stop with, we have to publicitize that this is the research we have done. Suppose we pick up diabetes, suppose we pick up hypertension, so we do anything for that matter, we have to publicitize. Only CCRH knows that such and such research is done and such and such effectiveness has been established, and only that team that who has done that research, they know that no, autism में homeopathy काम करता है, diabetes में homeopathy काम करता है, and that person somewhere going and presenting the research study, probably that much audience know. What about millions of people who are sitting out there and they think that there is nothing exist that can help them? So please understand, but with single thing of documentation, we can solving many problems. One is brand building and brand trust building. Second is research material building, which we can utilize for authentic paper creation. Now what would happen, not only our students, as I have many times requested to the policymakers, that some or the other way, the every year's research studies has to be submitted or created as a brief of, okay, at least one pager brief that, you know, this year I think 20 pages of research has been submitted to CCRH. This bodies has submitted, and this is the final result or conclusion has been drawn. Now what would happen, the newsletter that is coming to the child, or the, which is compulsory, again it's a, because even I was a student, इतना extensive syllabus होता है, हम कभी skin नहीं पढ़ते, हम कभी lymphatics नहीं पढ़ते, हमें जो क्वेश्चन पेपर में नहीं आता है मोस्टली हम नहीं पढ़ते, क्योंकि टाइम नहीं है, इतना पढ़ाई है, ठीक है। तो ये अगर मार्क और स्कोर बेरिंग अगर क्वेश्चन बन जाता है तो बच्चे को पढ़ना पड़ेगा तो उसको समझेगा कि ये रिसर्च हुए है और इसमें ये एफिकेसी है। प्रॉब्ली एक स्टूडियस बच्चा और क्यूरियस हो जाएगा और उस पर काम करेगा, या नहीं भी रहेगा तो भी इसको अवेयरनेस आएगा कि भाई डायबिटीज में भी होम्योपैथी काम कर सकती है। जिस दिन मेरे को लगेगा कि आई नीड टू वर्क ओवर डायबिटीज, ही वुड वर्क। So the challenge of confidence would be also solved by this kind of research building up and brand building up. So I have covered two challenges and one solution, and that is full foolproof kind of solution. I hope that would be put up across. Now the second, that was biggest challenge that was posed up, was lack of standardization. Now again, the same documentation, same research submission, same publicitization, now same thing can be all institute replicate. We can make more organized effort over here, where what we can do is, we will as a norm that I think that if there are people from NCH, or if there are people from CCRH or any kind of policy makers, every year we can put up a theme. This year so and so theme has been found, and this year we have to work over this. Now any biggest research study that is been submitted to CCRH will pick up that research study, and now every institution will be compelled to carry on the same kind of research in that community, because fundings are already there, and I think hardly there are any institution who are enthusiastically utilizing that funding. So here we are giving them target, because ultimately no one does. Forget about teachers, forget about students, forget about institutions. No one works without it is a mandate. So what we can do is, the policymakers can make every year a theme, that homeopathy and something. That is the biggest research probably last year, tuberculosis, any condition for that matter, and asking all the institution to submit minimum 100 cases jointly. Now what would happen? They will not only study the research, because abhi bahut sari cheeze, I need not to say what happens, but they will also verify, because aaj ki generation is very logical. They want proof. So we will make them to find the proof. Abhi, there would be, I think, many people who are associated with any institution as a academic faculty. Every one of us knows कि केस ड्रग प्रूविंग का एक सिंगल प्रोजेक्ट हर साल कंपलसरी रहता है सेकेंड ईयर में, और कितने इंस्टीट्यूशन और कितने बच्चे सीरियसली और ऑनेस्टली इसको करते हैं? नहीं करते. जबकि ड्रग प्रूविंग इज सो इम्पॉर्टेंट, क्योंकि मैंने इस बार भी आपको एक बहुत बड़ी नॉलेज गैप के बारे में, आई डोंट नो व्हिच सेशन आई हैव टोल्ड, बट मैंने कहा है कि इतनी बड़ी नॉलेज गैप है कि हमने हैनीमैन ने जर्मनी में और फ्रांस में प्रूफ किए हुए ड्रग्स, वहां के रेशियल जेनेटिक्स पे प्रूफ किए ड्रग्स, वहां के एनवायरनमेंट में प्रूफ किए हुए ड्रग्स, हम होम्योपैथ अभी इंडिया में अप्लाई करने की कोशिश कर रहे हैं. सो यू अंडरस्टैंड कि जलसीमियम इज चिली और हॉट, और ब्राइनिया इज हॉट और चिली. अपने को यहाँ पर, और वो जर्मनी में हॉट था, कैसे पता चलेगा? सो यहीं से आप देख लो कि हम कितना वैलिड एक्चुअली जो है मेडिसिन का यूज कर पा रहे हैं, और उसके बाद भी सक्सेसफुल है. सोचो, तो हमारा बेस ही वेस्टर्न है, जबकि हम अप्लाई इंडियन पे कर रहे हैं. सो रेशियल डिफरेंस है, सोशियो इकोनॉमिक डिफरेंस है, एनवायरमेंटल डिफरेंस है. जो भी ड्रग्स प्रूव वॉट एवर ड्रग्स आर बीन प्रूव, वी नो, वी शुड अंडरस्टैंड कि हाउ irrelevant they are. We need to reprove all the drugs. So it's a joint efforts within 2 or 3 years. If this kind of sincere efforts are done, then I think whole scenario of homeopathic practice and the students' confidence and the interest can be totally regained. We can rise again as a phoenix from the ashes to, command our power. That is the most authentic and most relevant and most realistic format of homeopathy. So the lack of standardization will also be fulfilled by the simple effort of standardization, documentation. There had been many points last year. Those who have attended the panel discussion, many challenges that is been put up very candidly by Rao sir, and I appreciate his guts to speak that, and I appreciate that insight that every one of us has come up with. But what I can understand is, any given situation, all you have to focus over is what you can do with your role and responsibility. And that's why I'm very honestly telling what we all can do with our roles and responsibility. I've told role of policymakers, so whoever are the policymakers in the room, they should understand now what they have to do. I've told what academician can do, they should understand what they have to do. And I have also called upon all the clinicians what they should do, and now they have to take the measures. And now we have a community also, so I've told what community can do. So all this can become a right reference point in the mind of, because today's generation is very clear, they are not emotional, they are not into any passion, they are very logical, they want paisa, they are very materialistic, and they are very result oriented, and for them the whole and sole criteria is money. We have to tell the kind of position profile and the kind of the lifestyle a homeopath can live. So we have to really give them that kind of reference point where they would also be motivated. Sometimes, we see someone and we feel inspired, okay, I want to be like her. I remember when I was student, I was just intern, and that time Vishpala Parthosarathy madam visited Nagpur, and she was there was a special seminar for her we organized, and I knew nothing what next to do and all. But when I saw her, And I just, when she was leaving on the airport, I said, Madam, I want to become like you. So I always used to call her my professional mom, and we stayed connected till end. So these are the reference points. These kind of reference point can create a huge difference in the mindset of young minds because they are still impressionable. So we have to make them learn what we want as a legacy, and we want to make them unlearn what they are perceiving and carrying in their minds. So this is something, a joint effort of all of us in the towards the profession. Now now I tried to find answer for one word which I was really not completely able to find. That is clinical exposure and the clinical education. I had been a part of academic institution, many institution in different role and positions, and I definitely wish to be so. And based on the kind of management approach and the freedom that it offers, the funding it offers, I always intend that the clinical medicine is not to be taught in classrooms. Medicine is to be taught in the section rooms, labs, OPDs and IPDs. It's आप classroom में pneumonia सिखा रहे हो. What's the point? Show him one case of pneumonia. Show him how you took the case. Show him what kind of totality you build up. Show him how you cured him live, if possible. If not possible, this documentation will again help. On video, on paper, in whatever ways. So जब तक आप ये देंगे नहीं documentation के format में, it will also create good clinical exposure. I appreciate our one of the faculty who is also faculty and most honored person, is my favorite one, who is Dr. A.K. Das. He is in process of building a hospital from where he wished to teach organon of medicine bedside. Varna, organon of medicine is to katha. That is how it is being taught in colleges. कथा है, ऊपर ऊपर कुछ कुछ लिख लो, नीचे स्टोरी लिख लो, मार्क्स मिल जाएंगे, और वैसा ही होता भी है. सो जो पूरा क्रक्स है, पूरा ऑपरेशनैलिटी है होम्योपैथी का, दैट इज ऑर्गेनल. एंड इफ दैट इज टॉट राइट, देन everyone can be as genius as A.K. Das. Because when we took his webinar with us, and when my overseas partner Maria was given the responsibility to conduct his introduction, and she said, oh my god, I need to take 2-3 births to become as qualified as he is. And I said, this is the hard work that doctor does. So the point is, the clinical training is the crux again, that those who are there in the academics, they have to make sure that this is happening. Those who are even at their clinics, make sure that they are associating with, because we also need people, right, to work at our clinics. So just go out, seek a closest college or hospital, talk to their interns, talk to their college people, and make sure that the interns, because interns has hardly 3 shifts, so they can manage. So make sure that those students are with you and you are training and demonstrating them. They are paying you, you are paying them, or no one is paying nobody, that's okay. But we have to make sure that wherever we are practicing, that methodology, if it is working, has to be shared with the students and the young generation. So try to reach out the institutions around it, have the interns with you, maybe in batches or some or the other way, but make sure that you have juniors with you so that they are learning how we are handling or managing cases. Let it be case taking, let it be counseling, let it be anything for that matter, let it be choosing a potency, because this is how we all have learned, right? So this is how we have to make sure. You're not in any institution, that's fine, but still record every case, still document every case, make sure students are there in OPD to learn live. So this is somewhere we have to reach out to the students and inculcate them the homeopathy, because please understand that nowadays generations, I think since 4-5 years or 7-8 years probably, this Students are not coming for the sake of homeopathy. They are not becoming homeopath. They are just becoming doctor, just doctor. And they would do any and everything with that degree except practicing a true homeopathy, because that is not been taught to them. So now, wherever we are, we have to give the solution, and the only target is the people who are going to come in the profession in their various role calls. Now again, since the topic allotted, sometimes people might feel that what am I talking, and where is the topic today? This is the topic, and this is how I am talking. What are the preventive or the solution aspect of it? This will, although I have reiterated that we have to work over students, but same lies true for the practitioners who are facing challenges. The associations can play a big role. Communities, the local communities can play a big role, because there they get confidence. So here the most adapted format that I would recommend is CMEs. Everywhere, any predominant association, because अभी तो ऐसे associations का भी ऐसा communalization हो गया है, school of thoughts आ गए हैं, now they are competing. So I mean, this is really, I don't know where it would go, but somewhere there has to be some neutral body or the joint body where all of them at least once a month sitting together. All students are to be participating. All the close by practitioners are to be participating and discussing around the cases, so that the joint solution is come. Even success stories are shared, failure stories are also shared. So CME could be one of those things where this documentation can be achieved, the standardization can be achieved, the research formation can be achieved, and the confidence building can also be achieved. So again, the clinical thing would be a great game changer. Working over more and more would be another cherry on the cake. So this is where somewhere we have to start. Now, we have to also understand the changing landscape of healthcare. I have presented, I think, couple of times over the interdisciplinary healthcare, the pluralistic healthcare. So not only the CME format of the homeopaths, but I would like to you guys to try in your areas, respective areas, to define how about bringing up interdisciplinary research. Interdisciplinary research means, or the interdisciplinary CMEs means, for that matter, homeopath, Ayurveda, allopath, naturopath, everyone is sitting there and discussing over probably say autoimmune disease, rheumatoid arthritis, allergies. Any theme of that month could be established, and where all of them are sitting together and churning over what best they can do. It would not only give them good networking, it will also add on good references. We reference allopaths should also refer us, and they do refer if they are logically convinced. So those who are ethical allopath, they would definitely refer the cases, and they themselves come to me for their treatment. Many Ayurvedic people come to me for the treatment, and they also refer patients. So this kind of trust building can also be established with interdisciplinary CMEs. So please check out how you guys can do that at your place, so that a good value is created. All types of students, all systems of students are there, and everyone has understanding what homeopathy can do with rheumatoid arthritis, what allopathy can do with rheumatoid arthritis, what Ayurveda, what naturopathy, what everyone can do about rheumatoid arthritis. And this is now government only bringing up, but we can also do at community level, we can do at our local level, we can do it at our association level. So this is something I really need, that clinical side, because now what we are doing is we are preparing not only ourselves, our future generation as a homeopath, to better fit for that interdisciplinary research, because pluralistic healthcare, one nation, one health is something I think all of us should be aware of. And we should also be aware of, if we are not ready for that change, how aram se we would be eliminated from the stage, because we are offered the stage and we have to perform. So we have to be really ready, and our swords should be like polished well, and we should be ready to run the show with best of the opportunities that are given to us. So this is somewhere I want, and meanwhile I want you all to really keep the points ready, ask the questions, or keep the questions, or even in chats, because I have done certain work over it. Uske baad mein, if these solutions are worked up, the second issue, the biggest issue that was faced was perception and credibility crisis, because we don't educate patient what best we have done. We don't publicize our result. And as a part of PR, we should definitely publicize what kind of results and what kind of consistent results. Jaise ki, for example, I've got very good edge over psoriasis. I've got very good edge over hypothyroidism. I've got very good edge over asthma. I know that if I handle a case of asthma for 2 months, let it be 20 years standing, it will never come back. And that's what happens. So I have got all the guts. I know when a thyroid case has come, I have handled it 6 months to 9 months based on whatever TSH and what kind of thyroid supplement that person is taking. I know that within 1 year, I can reverse that thyroid and that patient will never require the thyroid medicine. Come what may. I mean, I should publicize. Even I have not publicized it, but I should, right? So then what would happen? Everyone will read it. Then they will know कि okay, होम्योपैथी में थायराइड को ठीक करता है, होम्योपैथी सोरियासिस को भी ठीक करता है, होम्योपैथी अस्थमा को भी ठीक करता है, तो होम्योपैथी कॉन्स्टिपेशन एसिडिटी के लिए नहीं है. So see that common perception. Sometimes we had usually a World Homeopathy Day celebration at our Nagpur Hamai unit, and mostly I am one of the organizer. That day, I mean 2000, probably 2-3 years back, there was a gynecologist who was invited as a guest over there, and he said, "Okay, my sister is a homeopath. I know few homeopaths, and you guys are good in handling acidity and constipation and this and that." And fortunately and unfortunately, the responsibility of putting up a vote of thanks was with me. So my job was I seriously observing who speaks what. And then when I took up a mic, and I would, if possible, I'll share that live. When I took up the mic, I said, "Sir, thanks for your appreciation and trust that homeopathy can handle constipation and acidity. But let me tell you that homeopathy can manage cervical dystocia. Homeopathy can manage uterine inertia. Homeopathy can manage PIS, pulmonary pregnancy-induced hypertension, preeclampsia. So homeopathy can, and I have seen this live happening. So please refer us cases, or have someone on as a homeopath. यहाँ पे event में आके हमारी तारीफ तो आपको करनी पड़ेगी ना, क्योंकि you are their guest. But we don't want that tarif. We want that practical acknowledgement. If you feel really homeopaths are making any difference, at least ज़्यादा दूर मत जाओ. At least hire your sister to handle ANC issues, because anyways allopathy ज़्यादा तो नहीं दे सकते. So आप homeopathy को refer करो. आप इंटर लेबर में जो कॉम्प्लिकेशंस होते हैं वहां पे होम्योपैथी बहुत अच्छा काम कर सकती है. बट दे वुड नॉट लाइक टू उनका LSCS का केस खत्म हो जाएगा ना, क्योंकि होम्योपैथी तो नेचुरल डिलीवरी कर देगी. सो बट आई डिड नॉट से ऑफ कोर्स दैट वे, बट this is somewhere their subconscious is going. But I told that this is what we can do. What happened? I knew that he will never refer, because it's his loss. Because जसवंत पाटिल सर ऑल्सो सेज ना कि मैंने एथिकली होम्योपैथी जब प्रैक्टिस करना चालू किया, मेरा ओपीडी बहुत बढ़ गया, लेकिन मेरा आईपीडी बंद ही करना पड़ा, क्योंकि केसेस खराब ही नहीं हो रहे, किसी को आईपीडी की जरूरत ही नहीं है. एंड दिस इज पीपल और वर्ल्ड डज नॉट वांट टू नो. दिस इज वेयर पीपल डोंट वांट टू publicitize, and this is exactly we should be publicizing कि this is what we can do. Now tell us. So what I want to again say is कि we have to work over these things. This might sound very small, but this will create huge difference. Because I have seen how it affects the public mindset and the student mindset as well. Dhanesh sir is there, so I know that now that I should be limiting. Although I could not complete it completely because because there was no PPT, so naturally the flow definitely was not as it was planned. But of course,
No,
a reasonable time is required for.
Yes, thank you, Dr. Professor RSP Shukla, for coming over here and with the big subject that is the problem faced by homeopaths. As you know, there were 5 presentations consecutively in this forum. That means more than 15 doctors participate in different days for such a big session. But still, we need these things because everyone has to say a lot of things. There were problem faced by students also. There was a big discussion on that. One of the Dr. Dr. Roy K. James came over here. He is a gynecologist and he has turned to be a homeopath and is studying BHMS first year at Calicut. One of his presentation was exemplary brilliant and more than 2,500 persons watched the video within 2 weeks. That means that that kind of presentations need to reach among doctors, particularly in our own field itself. But still, people are sitting, doctors are sitting in the clinic and working for their income as well as their patients only. They are not bothered about how to protect homeopathy from different angle. That need to be discussed in a big way. That's the reason people, young dynamic doctors like you, are really an excellent thing for this session, homeopathy itself, because you people are doing great work in all respects. Your sessions were exemplary, brilliant also, and the thing you have suggested that we need to document it. That's what we can say that IFPH is reaching 2000, about to reach 2000 days in a short time. That is just 70 days ahead. Just within 170 days, we will be reaching 2000. That means more than 6,000. That is supposed to be, but there were some problem with some of our videos. But still, there are 4,000 videos already in the YouTube. No association has come forward for such things because they were keeping the videos for their selling purpose and collecting money from doctors and junior doctors. But it is for public. It is there as a document for the public, so that homeopathy will reach every home around the world. That is the purpose of this forum. That's the reason why we are coming over here and discussing different things every day. So this kind of that's why the International Forum for Promoting Homeopathy is entirely different from all other associations. We need an association, but we have tried to unite all of them under one umbrella. Whatever may be their name, it doesn't matter much. They should work together to protect homeopathy, and that's what I would like to add. And it is the time for discussion. I am inviting Dr. Jacob Matthew to begin the session, and then Dr. Manoj.
I'm sorry, Dr. Dhanesh. I missed most of the parts. I was in and out during the session. I came late. So anyway,
But
I'm going to start the session officially. You can you can follow me.
yes,
I couldn't get the I
but
couldn't attend
you,
the whole
but
time.
But you have worked for a long time for Homeopathic Association. But you really know what are the problem faced by the doctors, particularly in India. That's the reason you are a person practicing in USA, and you know the problems faced by you people there. Whether you are finding it very difficult to get medicines, or whether you are getting any support from the government there, and what kind of support you're getting. That way you can explain. That's what you can add to the session, because adding something to the session itself is a big one.
Yeah. Um, let me say about the difficulty of getting medicines from each medicine here. It's too hard to get the medicines here. Last year during December, somebody asked Manoj about the issue, getting medicines here. So he sent an email, sent a WhatsApp message to me, but I found that message yesterday evening. So I was a little bit prepared to give an answer to those questions about the availability of medicines here. I can take 5 minutes, right?
Yes.
The main pharmacy we are having here is Boron, USA. So you'll get the details about their medications, medicines, and everything in boronusa.com. And the second one is homeopathyworks.com. The name of their pharmacy is Washington Homeopathy. Washington Homeopathy. It's in Washington, DC. Their website is homeopathyworks.com. And another one, OLLOIS. Sorry, give me a second.
You can write it down so that there are problems in not only in India but around the world also. What are the things we can do for them also? Because a lot of our patients are residing in Western countries, but when they came over here, we will be able to give medicines to them. And but in case of emergency, what can we do? Yes.
If you have such an emergency, I can send medicines for
Yes,
patients from here.
Can you please write it down on the message session so that everybody can watch it? And Dr. Rashmi Shukla want to say something. Okay.
Here, what happens is the way the modern medicine has created a kind of ecosystem, we have failed to create a kind of ecosystem of mutual references. For example, if I am not doing or somewhere I am doing very great thing, hypothyroidism, and some other homeopath wants to refer that case to me, they should refer. And if I think that, okay, Danesh sir is handling epilepsy cases well, let me refer to them. So that kind of mutual reference system ka ecosystem has to be created. So I wish if this community can be coming up with certain expertise, that okay, these are my expertise, these are your expertise, so we can actually segregate them. Because what would happen if somehow or some ways we are not able to create a good result with the patient is not only going to leave you, but also going to be keeping negative image of homeopathy forever. So better that we should refer it to someone who can handle it well. So this is somewhere we really need to really work toward. He has written allyosis.com. And the overseas, I do have many patients overseas from Canada and almost all continents. So their waiting period for that consultation or practitioner is really miserable. So here, although the good doctors already are accepting, pushmycart.com also Jacob sir is mentioning. So we can create again ecosystem for overseas patient also, and we can create according to expertise wise, we can just refer the cases so that the patient is also benefit and all of us can also be benefited. Over to you, sir. The necessary.
Doctor, we can use these websites to get the medicines. They will send it to you. If you pay through the credit card, they will send those medicines. But I don't know. I prefer this pushmycard.com. That's based in California. They used to purchase medicines from Germany or India, and they will supply to us. That's the best way to get the medicines here. As far as concerned to Boron USA, I think they don't have this mother tinctures and batch flower remedies, anything like that. Washington Homeopathy also, they don't have batch flower remedies, higher potencies, and everything like that. And there is another issue here. If you want to get 1 or higher potency, we are not supposed to prescribe that. if you want to prescribe, if you want to get those medicines, it should be prescribed by allopathic MD doctor.
Sir, here you can do one thing. You can have your Indian homeopathic counterpart. The way suppose.
But I have everything here. I have everything here. I have everything here, even much for remedies. I used to import it from Calicut. One of my friends have a medical store there. With my registration certificate and passport copy, they can send it to me. I have everything here, but I don't have medicines to give to some other doctors as a wholesale. But if if you or anybody have a patient, I can send it to them right away from here. Not
Okay,
as a
sir.
bulk.
That's a great
Okay.
thing.
Okay, sir. Our time is about to already finished, but so I am inviting Dr. Manoj to say vote of thanks to the session.
Thank you, Dr. Sanesh and Dr. Rashmi Shukla. Nice session, but the points you mentioned were relevant, but not so to our people. That's a problem. The homeopathy physician must be first sensitized. That's the most important thing. On behalf of IFPH, I express a sincere thank to Professor Rashmi Shukla and all those participating in this English session. Thank you.
Thank you, Dr. Manoj, Dr. Jacob Matthew, and those who attended the session, and particularly our thanks to Professor Dr. Rashmi Shukla for coming over his and delivering a wonderful speech. Thank you all. Good night. And tomorrow we will have a session from Dr. Mashood, and he will be talking about some of his clinical experience as well as experiments with homeopathy with the plant remedies, plants also. There is an announcement for tomorrow for all of you, because IFBH is celebrating its 5th anniversary on 28th of September. Hope all of you will register for the same, rupees 3,000 per person, and it is being conducted at Taj Vivenda Cochin. Hope all of you will register, and you can, those who are unable to come over here can give a support by giving your contribution to IFBH. Thank you all. Good night. It's over to Dr. Manoj.